We're going to take a look at growth hormone in this lecture. So growth hormone is one of the anterior pituitary hormones, and it's a protein hormone. And the two effects of growth hormone is one, it's obviously going to cause growth in both the bones and also in soft tissues. So that could be muscles, organs, and skin. And then it also causes changes in metabolism. So one thing it does is that it'll increase protein synthesis. And that's important because if you have cells that are growing, they're going to be dividing, and so they're going to need to be making a lot more proteins. So that's an important function of growth hormone, to increase protein synthesis. And then another thing that growth hormone will do with metabolism is it needs to mobilize the energy stores, and it will stimulate lipolysis, so breaking down the triglycerides that are stored in the adipose tissue and releasing those fatty acids into the blood. And then it also will increase the blood glucose. And so that'll make the fatty acids and glucose available as an energy source for those cells that are dividing and growing, and then they can go ahead and do that. So growth hormone has two different ways that it can act. So one is that it can act directly on the tissues. So it can go right to the body cells and tell them to grow or change their metabolism. And then the second pathway that growth hormone will follow is that it will go to the liver. And then it will tell the liver to release a hormone called insulin-like growth factor. And that's abbreviated IGF. And the reason they call it that is because insulin-like growth factor is very similar in structure to insulin. So it's another protein hormone like insulin is. And that insulin-like growth factor will go to the body cells and then tell them to grow or to change their metabolism. So let's just draw this out. And we're going to start up here with the hypothalamus. And remember, we've got these neurons in the hypothalamus that are secreting the hypothalamic hormones. So there's two hormones that control the anterior pituitary, whether or not it's going to be releasing growth hormone. So the hypothalamic hormone that tells the anterior pituitary to release growth hormone would be growth hormone releasing hormone. So we're going to have our neurons secrete growth hormone releasing hormone into the portal system. And then the other hypothalamic hormone is growth hormone inhibiting hormone, or GH. And then that would tell the anterior pituitary to not release growth hormone. But we're going to go ahead and release growth hormone, so we're going to have hypothalamus release GHRH into the portal system. So GHRH gets taken by the portal system to the anterior pituitary, and then GHRH will be delivered to the endocrine cells in the anterior pituitary, and will tell those cells to secrete growth hormone. So then they will secrete growth hormone into the bloodstream. And then growth hormone is going to take off and has two pathways. So the blood can deliver the growth hormone directly to the body cells, where it can tell those cells to grow or change their metabolism. And then the other pathway that growth hormone can follow is that it can go to the liver. And then the growth hormone will tell the liver to secrete a hormone, insulin-like growth factor. And then the insulin-like growth factors will then travel to the body cells and then tell them to grow or change their metabolism. And so those are the two pathways of growth hormone. Okay, and as far as regulating the levels of growth hormone, we're going to use some negative feedback. So growth hormone itself can negatively feed back here onto the hypothalamus. So when we've got too much growth hormone being secreted, it'll feed back on the hypothalamus and say, hey, we don't need any more GHRH released, and the hypothalamus will stop releasing that. And then also we have the insulin-like growth factor can have a negative feedback effect as well, and feedback on the anterior pituitary and say, hey, we've got enough growth hormone, stop releasing that. And that insulin-like growth factor can also have a negative feedback effect as well on the hypothalamus and tell it to stop releasing the GHRH. And that'll keep the growth hormone levels in the normal range. Okay, and this is just a nice flow chart from your book that goes over the actions of growth hormone. So if we start up here at the top, remember hypothalamus is in charge here. We've got the two hormones, GHRH and GHIH. So if we have GHRH being released by the hypothalamus into the portal system, goes to the anterior pituitary, it tells the anterior pituitary to release growth hormone. And then growth hormone can go directly to the body tissues, or it can go to the liver. If it goes to the liver, it tells the liver to secrete the insulin-like growth factors, and then the insulin-like growth factors travel to the body cells and then tell them to grow or change their metabolism. And then if the growth hormone goes directly to the tissues itself, it can tell them to grow or change their metabolism. And then this one is just showing changing some of the metabolism, so increasing protein synthesis, and then also increasing the blood glucose in the blood. So it can do that by, for example, telling the adipose in the muscle, hey, don't take up the glucose, leave that out in the blood for the growing cells to use. And then also it'll tell the adipose tissue to start breaking down the triglyceride stores, doing lipolysis to release the fatty acids into the blood. And then the growing cells can use the fatty acids and glucose so they can go ahead and grow. And then also this is just showing you the negative feedback loops and just showing you how we can control the levels of growth hormone. And I'm not going to ask you the difference between the short loop or negative, or sorry, the short loop or the long loop negative feedback loops. Okay, another thing that controls growth hormone secretion, there is a circadian rhythm, which is kind of interesting. So if you look at our time frame over here on the right, you notice that there is a spike in growth hormone secretion late at night, and that is, there's a clock in our brain in the hypothalamus that actually will control that. And I don't know if you remember when you were a kid, if you ever experienced those growing pains, those sharp pains like in your legs, they usually happen late at night, and that kind of makes sense. That's when a lot of the growth hormone was being secreted. Other things that can affect growth hormone secretion, stress can actually decrease growth hormone secretion, and fasting. So if you're not getting enough to eat, that can actually stunt your growth because you're not secreting as much growth hormone either. Okay, and then there's also, with age, we get a decrease in growth hormone secretion. So obviously, when you're younger, you're going to be secreting a lot more growth hormone, but then as you age, the amount of growth hormone you secrete from your anterior pituitary gradually decreases. And we think this is involved in the aging process and why we age. So this has to do with growth hormone's effect on our metabolism. So remember that growth hormone increases protein synthesis. So as you age, your muscle mass decreases, and part of that is because of the decrease in growth hormone, because you're no longer making as many proteins, and so you're not making as many proteins in your muscles anymore, and so your muscle mass will decrease. And then also your skin will get wrinkled and thin, and that also has to do with the decreased protein synthesis, because you're no longer making as much collagen and elastin in your skin, and that'll cause your skin to get wrinkled and thin. And then also, as you age, you increase your body fat, unfortunately. And that's also because of growth hormone. Because growth hormone stimulates the body to break down your fat stores. And because you have less growth hormone, you're not doing that as much anymore. And so they stick around. So why don't we just give old people growth hormone? It would be like the fountain of youth, wouldn't it? Yeah, they would do better. You would gain muscle mass, you would lose weight. Yeah, you'd feel better, but there's a big problem with giving growth hormone. Because remember, the other effect on metabolism is it increases your blood glucose. And so it could increase your risk of turning you into a type 2 diabetic, which would be a big problem. And it can also cause another issue called acromegaly, which we'll talk about in a minute as well. Okay, and then just a reminder how growth hormone works on the bones. Growth hormone will stimulate the growth plates here, the epiphyseal plates here on the ends of the bones. There's some cartilage there, and growth hormone will stimulate those cartilage cells to divide, and then those new cartilage cells will move towards the middle of the bone, and they will then turn into bone cells. They'll mineralize, and so that's the direction of the bone growth. So it's kind of the opposite of what you think the way the bone would grow. So your bone actually grows towards the middle of the bone. Okay, and then let's just talk about some problems with growth hormone. There's 3 of them that I want you to know. So dwarfism. So this is decreased growth hormone secretion as a child. So there's a couple of causes for this. One of them is called achondroplasia. And this is a genetic mutation where there's a receptor that's too active, and this receptor is involved in inhibiting bone growth. And that's probably the most common cause of dwarfism. And then another one is growth hormone deficiency, which there's a lot of different causes for that. But obviously, if you've got not enough growth hormone secretion, or the growth hormone is not able to work correctly, you're not going to grow as tall as you should. And then the opposite would be gigantism. And this is increased growth hormone secretion in kids. So this is usually caused by a pituitary tumor in the anterior pituitary, where the cells that produce the growth hormone turn into tumor cells, and they just secrete way too much growth hormone. And so you just keep growing and growing, and you turn into a giant. And we'll look at a picture of this in a minute. And then the other one is called acromegaly. And this is where you get the pituitary tumor, where you've got too much growth hormone being secreted as an adult. So your growth plates have already closed, and you can't grow any taller, but some other things will happen instead. Okay, so this is gigantism. This is Robert Wadlow. He grew to be 8 feet 11 inches, and he was still growing at the time that he died when he was 22 years old. What happened is he ended up having to wear some braces on his legs because he was having some problems with walking and some problems feeling his feet, and the braces didn't fit very well, and they rubbed a sore on his ankle, and it got infected. And this was in 1940, before they had antibiotics. and the infection actually killed him. And so he was actually still growing at the time of his death. So he probably would have grown even taller than that. And he weighed 439 pounds, and he was not fat at all. He obviously had to have custom-made clothing, custom-made shoes, because you couldn't just go in a store and buy stuff off the rack. But he had a tumor in his anterior pituitary that was secreting too much growth hormone that he got as a child, and he just kept growing. So, and his growth plates had still not closed at the time of his death. So, okay, and then this is acromegaly. So this is increased growth hormone in an adult. So you end up with the anterior pituitary tumor as an adult. Your growth plates have already closed, so you can't grow any taller. But what happens is your extremities will grow larger. So the word acromegaly. So acro is talking about your extremities, and mega means big. So looking at these pictures, so of the hands here, the one on the right is a normal size hand. And then these two hands on the left is from someone with acromegaly. So your hands can get large, so they can grow. And then your feet will also grow. And that looks pretty painful. And it looks like it'd be pretty hard to find shoes as well. And then the other sad thing that happens with acromegaly is that your skull will also grow. And so it really changes your appearance. So you can see this young woman at the age of 16. She did not have the anterior pituitary tumor yet. She was very attractive. And then you could see at age 33, you could see the effects of the anterior pituitary tumor that is producing too much growth hormone. So you can really see that her skull has grown. And then here she is at age 52. So you can see how much larger her skull has grown compared to what it was when she was 16. So they can really change in appearance. And then the other thing that can happen is that because the growth hormone changes your metabolism, it can also increase their risk of getting type 2 diabetes because it does increase the blood glucose as well. Okay, and then here we've just filled out our little chart here a little bit more. Remember flat pig, these are all the hormones secreted by the anterior pituitary. And here's our growth hormone over here. And remember, this all starts up here at the hypothalamus. Remember, the hypothalamus is in charge. And the two hormones that control growth hormone release from the anterior pituitary are growth hormone releasing hormone and growth hormone inhibiting hormone. And so the anterior pituitary will release growth hormone if hypothalamus secretes growth hormone releasing hormone. And then the growth hormone can directly act on the body cells or go to the liver first and then tell the liver to secrete the insulin-like growth factors. And then remember that the growth hormone can do two things, can tell the cells to grow or can change the metabolism. So we'll either increase protein synthesis because growing cells need to make a lot of proteins, or can go to the adipose tissue, tell them to break down the fat stores, release the fatty acids, increasing the blood glucose as well. And that'll provide energy source for the growing cells to use. And then the three problems we have with growth hormone that I want you to know: dwarfism, gigantism, and then acromegaly.